So welcome everyone. We decided this month to think about a specific topic, which can be obviously applied for different types of exercises, but why boxing? Boxing has become very popular in the Parkinson community. And so it seems reasonable for us to be able to provide skills so that people understand how do I make choices when I'm doing certain exercises that associate boxing as well. Is it suitable for me or not? When do I start? When do I change? So just opening up here the conversation about it. And I will say that we have training in boxing. Obviously, I'd like to. I'm a natural curious person which likes to take different courses and try to understand how we can apply it better and adapt it to people with Parkinson. So you will see different versions of our position regarding boxing. But the first position is most people, I would say 99% of the people that I work with that where we use boxing really love it. But that doesn't mean there's a 1% that might not work, right? So I think it's about us thinking in what situations maybe it's not so applicable or not. So please feel free to jump in and to tell us your experiences. I'm pretty sure people are here have tried it or are doing it now. We did want to start off by sharing with you. So in order to guide these presentations so that they can be very specific to the people that are on the call with us, we send out a questionnaire so that we can approach your questions already in the presentation. And just sharing you with the first question that we wanted to approach was the person participating or not in any boxing class? The relevance was for us to see how we can create content for someone that's already participating or someone that has never tried it, so that we can approach everyone in the talk. And it was actually a surprising outcome. I was expecting a little bit more people doing it in this group, but we had 60% of the people said they weren't participating. So following our rationale here is like, okay, so let's look at the people that said yes and that they were participating. What was the reasons why?
Yeah, when you see people doing this, often it comes from a therapist recommending it, or maybe even your doctor. Those are two people that usually have a lot of influence on what kind of exercises you might do. If you have a neurologist that lets flyers, sometimes they don't, but I bet you they do at Innova. You might get a flyer from somebody in the area as well, and that's another way. Research on the Rocksteady boxing programs, and that's probably the most common one. If you've done it, you probably heard of it. We're going to talk a little bit about their research and some of the other research, but there are now growing numbers of Parkinson's boxing programs around the country, in the world actually. Okay, yeah, and then people who just want to try something new, I think that captures a lot of attention pretty quickly because it's so like, wait, I'm punching things. Most of us don't grow up doing that very much, and so it's a nice diversion.
Some of us would like to.
Yes. Yeah, and then this is when we were trying to parse through this, but someone in a care partners group did it. So maybe some people are coming with their spouses. I know that the Rocksteady boxing approach particularly has these corner men or corner persons where they have the spouse come in there and provide extra support, and that allows them to accommodate a wide range of different people in their classes, which is nice. Yeah, and then word of mouth is just like so many other things. You go to a support group meeting, you ask other people what they're doing, you may have heard about it.
Mm-hmm. Now, this is not by order of importance or anything. This was all comments that were placed inside the questionnaires. Okay.
Exactly. Yeah, this is again getting in. I think probably the most powerful recommendations come from other people in the same boat as you. I mean, the doctors, and we have our opinions, but I'm sure you get a lot from others going through what you're going through, lived experience. Yes, this is dangerous. We actually were doing a program with someone who boxed as a kid, and every now and then you get in there when you're doing class, and all of a sudden someone's killing you, and you're like, "What's going on here?" Like, "Oh, they did this when we were younger," and then that's actually dangerous. Remember the guy in Sweden? That guy about killed me. And then it helps with symptoms.
Yeah. So I think this overall, I think the most influence, as John said, is really the people that have Parkinson, and this is what justified the fact that it outgrew the research. So it's become so popular that the scientific community became desperate to create research for it because everyone was just doing it, and now we have to test it, right?
Yeah.
So, but there were people that said that they weren't doing it, and we wanted to explore the reasons why as well. This was more or less by percentage. So we had about 25% that answered this question. One that answered, I preferred alternative forms of exercise. So yeah, boxing is not for me. I prefer something different. Or maybe the transportation and distance make it difficult to attend boxing classes. And with less percentage, also reasons to not participate was a person having concerns about the intensity of the boxing for one's health, and maybe a fear of injuries associated with boxing. Or maybe they haven't found a suitable boxing class. So these were all reasons presented. Let's see, less but also present was concerns about physical limitations that prevent the person from participating. So if you have something that's limiting you, a big one, schedules not conflicting, so you don't have the right times. We have other reasons like medical reasons that don't allow, also in line with either physical limitations or some medical issue already that pre-exists, like arthritis. And then also somebody mentioned that I am not aware of any boxing classes for Parkinson in my area. So this is, hopefully we can help then, just sharing places that might exist. And then of course, I'm just not interested in boxing. So that could be several reasons why, which makes us think now, okay, so how do I know if boxing is suitable or not? When you say suitable, it depends on a lot of things. And let's think about criteria that would help me decide this, because you see the whole community, Parkinson community is doing boxing. So you go to any support groups and, I'm doing boxing. You go to the doctors, oh, you should do boxing. So suddenly it's like this question is like, how do I know if this is suitable for me? This is where this came from. Most decisions that are made about exercise, you will see several therapists always saying, do you enjoy it? Do you like it? Do what you like. This is something that you will hear often. I've added in a different thought, which is if I believe I can do it. So people will try it if they believe they can do it, right? We have ideas about the effort. We have already defined things that maybe we can and can't do. So these will be two that I would say more personal criteria that will help you decide. But now sharing with you what the other, I would say, health professionals, scientific communities, what are they thinking about, right? So what would be other criteria? And this would be, is it effective for my needs or goals? So everybody that registers in some sort of exercise has a goal. I want to improve A, B, C, and D. And can this type of exercise help me with that? The other question to ask yourself, is it safe for me? Now, safe can have a lot of interpretations, right? It's not only physical injury, it can be also at a different level of fatigue as well, non-motor. We will discuss a little bit of that. What can safe mean? And then obviously practical context things, which would be, is it accessible? So if I'm taking 2 hours to be able to reach a boxing gym, and I stay there another 2 hours, and then I take 2 hours to come home, we've dedicated a whole afternoon to one activity. To what point are we taking that away from other activities that you might want to do that will improve your quality of life? So these are questions that people are probably bouncing up and down to make that decision, right? Balancing it. So let us start from our first question is if it is really effective, if it's reaching my goals. Let's take this up here. So what would it mean to be effective? Anyone? Let me challenge the group. What is being effective? Nowadays, this is so questioned. This is my suggestion. Our suggestion here will be, okay, so how does it make you feel after? And this is one of the questions that we placed in the questionnaire. Every question has a goal for us to use and to also help you reflect better on the topic itself. So how do I feel after? It's usually a great guidance about how effective it is. And we had a very interesting, different, colorful outcomes here. And let us go through the different options that came out. So 36%, about 36% said they felt energized, empowered, and invigorated. Now, this is what we want to with any exercise, right? So this is, and I think boxing really captures the empowerment because it's about the concept of fighting back. The person really feels that he's able to do something that he probably didn't imagine that he would be able to do, and that empowers us. This goes in line now with something even more bold than I would say the climbing, right? Climbing for Parkinson. It's even a greater challenge, but in the similar format, people think that boxing is associated to fighting back. Then we have,
they just both play against type is what I think I like about them. Both like, wow, I never thought about doing this when I was younger, and it's like, that's kind of cool.
And then we had a couple of people that said it makes I feel relaxed, stress-free, and less anxious. So we really get a taste here that it's more than just a physical exercise, right? It really has an impact on mood as well. And even better than that will be the other group that says more focused, clear-minded, and mentally alert. So that means we also perceive here some benefits over cognition, our capacity to be more attentive. Okay, then we get into the green, and here we're getting into more negative response, which would be I feel sore and I feel physically tired. Now, this could be positive or negative, right? Because some people will endure workouts differently. And I would say it's perfectly normal for me to be a little bit physically tired after an exercise. That means I just worked out. This could be a belief. And the only way that we can decide if this is problematic or not is how long does that last, right? So if you go take a boxing class in the morning and then the rest of the afternoon you are covering bed, I think you can see that obviously that is stealing you of quality of life. It's stealing your life actually, sleep. So that would be one criteria for you to be able to use to assess if it really makes sense. No type of exercise should take you to recover a whole afternoon. We have mentally fatigued, and this is probably associated, as everyone maybe, or maybe who's less familiar with it, boxing has integrated movement, and it also integrates quick reactions with a lot of cognitive challenges of interpreting quickly what is going on. Like, so if you think about the punches and where the type of punches that exist, and so you have this whole number system. This is 1, this is 2, this is 3, this is 1, 1, 2, this is 3, 4, 5. So there's a lot of cognitive training associated to the movement, nice reaction training. And as you can see, it was one of the first forms of dual task training that we started using in Parkinson. Also one of the reasons why I fell in love with it because of that, right? Okay, then we had some other people that will associate with mentally and physically tired. So it's getting both levels. Okay, again, this could be good or bad depending on how long does it last after. If you were quick to recover, if probably, what would we do if it does take a long time? So we can do several things. First of all, I would say report it to the instructor, maybe reduce the dosage itself, the effort, the amount of effort that you're doing in the exercise. You could reduce the time as well. So instead of maybe being 2 hours, being 1 hour and a half, or being one, it can also help you. So maybe it's not about the intensity of the exercise, but it's just about the amount of time that people are investing in the activity itself. Okay, and I think tired but good, reinforcing what I was saying, that sometimes we do want to have this feeling that we actually worked out. So most people will associate feeling slightly tired good. We want to share throughout our presentation today the source of information, which I would say social media is very powerful at this moment. And so we used it to try to see what were the perceived benefits of boxing among people with Parkinson. So we will share some of these. And in this case, I would say, would you say yes, it is suitable for this person or not? So let's do this exercise. I started at a 9 round 2 weeks ago. I left in tears today. I'm usually very positive. Today was hard. It really exasperated my inabilities. As a clinician, as a therapist, as a friend of Parkinson, I would think this is what concerns me most about boxing, which is We push people a lot. That's true. In any exercise, we're trying to push the person to its best potential, to his best potential. But our concern is we know that we are dealing with a disease that progresses. And so how do we adapt to the changes as well so that these type of situations don't happen? So at the same time, we want to, okay, let's do 5 rounds today. The next time the person comes in today, we're going to do 6. And the next time we're going to do 12. And how do we deal with incapacity? So this, I don't have the answer to this. We don't have it in terms of research. I think we're still going by feeling how to manage it.
I mean, that's really important. I mean, if you hopefully when you're going to a class, the instructor's checking in with everybody and monitoring everybody. And even when we teach online, we keep the cameras on, we keep the mics on because we want to be able to monitor. And if you don't do that, if you just set it and forget it.
And it's, as you can imagine, all these activities are done most commonly in groups, and sometimes very big groups, which I think is a huge challenge for the instructors, right? To be able to monitor all the people and to really be on top of everyone's needs. So yeah, I don't think we have all the answers yet, but I think one answer is giving knowledge to the person with Parkinson's so that you can self-assess, so that you can be empowered to have that knowledge and to be able to go up to the instructor, you know what, I really felt sad because of this or that, right? Or this didn't work. So you can help them in this very challenging effort of monitoring such a group.
Yeah.
Again, it's about empowering people with knowledge. Okay, so that was one criteria that you can use, is how do I feel after? Again, any of these criteria you can use for any exercise that you're doing currently. Okay, it doesn't have to be boxing. And the other one, does it achieve my goals? Okay, so let's think about the group that is here, that participated in our questionnaire. What were their goals that you shared? We took a couple of them, and these were the goals that people shared with us. So general improvement, to stop progression, have fun, stay well. I really like this one. Coordination, conditioning, rhythm. Okay, we know that boxing has a lot of rhythm in the arms and as we're moving, and it can also incorporate movement on the legs, and also in most common boxing classes, remember, they might have variations, but they follow a more or less the same warm-up, and then you have some circuit training, and then you might have some variations of strength training, and then you end with a cool down, right? So you don't have only the boxing. I'm not there only punching. There's a whole combination of things, so it's totally feasible for you to achieve these goals. Keep slowing down Parkinson's disease. And coming back to the first one as well, let me share that the best knowledge that we know at this moment that helps control the progression of the disease is aerobic exercise, and boxing is pretty aerobic. And so, yes, for who placed this as a goal, boxing will help you with that. Is as long as we're doing something that really increases our heart rate, we are working on that. We want to keep our brain nice and oxygen going, flowing. So it goes also in line with many people choose that as an activity to stay well and to slow down the progression. Interesting response that we got here. The person does 6 classes a week. That's amazing.
Yeah.
I'm happy that the person keeps this motivation. I don't know who wrote this, but I would say my only concern is, does this compromise you doing other things that might also be helpful? Again, it comes back to what are the main goals? What is the person dealing with? Imagine the person only likes to do boxing, so there's absolutely no reason for us to change this, right? Because motivation then will become a problem, and we want to keep people motivated. Is there something wrong with doing always the same thing? We can't say there's something wrong. We can say that variation is usually more positive.
And you're addressing different muscle groups. You're doing different kinds of activities that do different things. Maybe something's more balance focused, one's more gait focused, something's more upper body strength focused. But you can again, you can find a way in there. I just feel sorry for someone who might try to mug that unsuspecting person.
I would.
For 6 days a week.
So our concern is, if you are in comfort zone, And we know how growth is outside of our comfort zone. You must hear this often. And if we're only doing comfortable things, we're not quite challenging ourselves, even if it's very physically intense. But the truth is, to what point am I really cognitively engaged and challenging myself with new things? And believe me that cognition is at different levels. Even just understanding the busy environment where these classes take place is already a cognitive skill that you are training as you go in, managing the places where to go, everyone talking or everyone doing something, right? The social interaction is very strong also in cognition. So the groups, exercise groups are really rich for this. And then we had someone else that said no specific goals. I'm interested to hear what those could be. So this could also go in line with people that might not be doing it and that have never had the opportunity to really think about it. Why would they make the effort of actually doing it or going to do it? The truth is, there's also a third, I would say, criteria. That is what we perceive as results, right? So, and this one I'd be cautious because sometimes we do things that are good for us and we might not perceive that the benefits, because again, we are fighting against progression. And so I say my profession is truly difficult because people only know what I do when they stop doing it, right? Will feel the benefit. But no, so people get better and we want them to get better and then they stay better. And so sometimes you might not perceive the benefit, but it could be another criterion. So even this gentleman was humorously sharing this and I thought it was adorable too. But he can say, I could see, if not feel, the benefits of boxing. And so this is not like a pill that I take and I feel the benefits one day after. Usually any type of exercise takes a while. So I'd say at least a month or so, then you can start feeling some difference.
I remember seeing research about the effect of this kind of vigorous exercise, not boxing specifically, but on sleep, and the benefits took 6 months to show up. So it can take a bit of time to have it affect those kind of factors, but hopefully you're able to see it.
I would say in terms of research for at 1 month training 3 times a week, you are supposed to expect benefits already over balance, over gait, over physical capacity. There's enough research to support that.
Doubling that to 6 times a week won't make that happen faster, but
don't know yet.
Well, yes, the research will see.
Okay, so everyone doing good? We'll have to do breaks with punching, right? Okay, so so can people benefit? What benefits would people perceive? And this was one of the questions also from our questionnaire, is like, okay, do people actually perceive benefit? And what we see is, yes, some people mentioned that they perceived benefits over coordination, over strength, over footwork. When I think you perceive over footwork, there must be one very good program. Is more stopped in terms of feet, but that's excellent. And then somebody said, nope, last class was 3 years ago. Again, as I mentioned, we might be doing something that is good, but we do not perceive it. We had other comments like strength and balance and endurance it's easier for us to be able to perceive benefits over physical things, right? So you have strength, and then when we feel over fatigue, which is more non-motor issues, even mood, if I feel that I'm more alert, like we saw before, so those might be harder to perceive, but sure enough, we have balance is better. Absolutely, the person feels the benefit, abdominal core strength. So again, boxing incorporates different types of activities, including strength training. And then the person has slowed the progression of Parkinson compared to how fast the doctors thought. Okay, that's good. And then we had coordination, balance, and small improvement for a short time. Okay, so overall, what keeps us motivated is when we're having results and we go do something and then we feel that it's helping us. But there is another, I would say, another criteria that also helps us support decisions that we make. And this is why there's, I would say in a more humorous way, so much money that's being invested in research so that it can help guide these decisions, right? So it is, I would say it should be the number one criteria that we use. When something new comes up, we should think about what is the evidence, what are the barriers for evidence. But like I said in the beginning, boxing was just so popular that it outgrew completely the evidence. We are just going to highlight one or the other, not all of it. There's still not a lot of studies, about maybe 10 or 12, so we could actually, but just for the sake of giving you a glimpse of what was researched, means what was the community asking, what were the questions that people were asking about boxing.
Yeah, and I think, again, starting with Rocksteady Boxing, which is probably the first one most people became familiar with, there were a pair of studies that came out. This was Stephanie Combs from Rocksteady Boxing. It's in Indianapolis, so this is where it came from. And it started with what we call a case series, where you basically do a case study on an individual, and then you compare them to the other individuals in succession. And it was small but beneficial effects. A lot of it had to do with perceptions of either emotional state or quality of life. With some, like they did a whole bunch of measures. I think they did 12 different measures, and only 5 of them really showed major benefits, and most of them were questionnaires, with the exception of balance and endurance. And endurance makes a lot of sense because it's a physical exercise. There's a lot of cardio to it. And then they followed that up later on with a much larger study with 31 people, a number more people, and it was a controlled trial. They had a group of people coming in there, and they're doing the same kind of testing. And again, the primary benefits were on balance and kind of physical endurance, as well as some quality of life. But then if you get into more like a timed up and go or something like that, didn't seem to show as much benefit.
In the middle of all that research, and as I said, it became so popular that I was like, okay, I got to see what's happening. Why are people doing this, right? So just to share with you, then decided to research it. This is also part of my PhD that I'm doing. And basically my questions were, how do we implement this? Should this be implemented in a clinic? Should this be implemented in the community? Who are we going to include? Who should be doing the teaching? So lots of questions about implementation itself. And so this was one of the first research papers that we did together with a group from the Netherlands. And so let me tell you a little story about it, right? So it's different when we actually do the research. We can tell you the challenges that we had. The main goal, I would say, would be for us to be able to implement the program. So on your left there, you see Sarah Regard, and she came over to do a program with me, and we tried out the boxing, and she really liked it, and said, okay, so what can we do for her to do something at home where she lives in Sweden, right? And so together we decided to implement this program, and it's actually in a boxing club.
Narva Boxing Club, which was founded in 1935 and was an adorable little place that looked like something from a Rocky movie. It was literally set up that way with posters and old mats and everything. It was really cute, though.
Yeah, so what we set up, what would be the phases of us being able to implement it in a non-clinical environment, right? I was already applying it in the clinic, but let's think about non-clinical. So the first thing that we had to do is think about, okay, we need an educational workshop for the instructors. We need to tell them about Parkinson, how it progresses, how maybe people can react to the different types of exercises. And we did this in a particular way. So we had Sarah's input as well. She was one of the teachers, the instructors. So we had a combined educational course for the instructors with lots of videos, lots of practical things. We added in a component of voice that would be also relevant, and we'll touch upon it in
later on. Yep, that's novel, but it's also. Yeah. When we did this in Colorado, they had an in-house boxing program, and that's exactly where I used that first. And I think it's valuable. The voice should always be part of every exercise if you can find a way to, pitch over. But I really think voice is valuable for these environments.
In the same day, what we did is, so in the morning we had the educational programs for the instructors. This was done in 2 or 3 days. And then in the afternoon, we invited a group of people with Parkinson through the Parkinson Patient Association to come try it out. They've never tried it, and we decided to try some exercises. And so by this, the instructors were already there, and they got their first experience already seeing people with Parkinson. So it was how we organized the educational workshop. These are just pictures from the moments. I like how the instructor is eating chocolate and watching us sweat
Yes, it's a big important
No, it
part
was
of
an
that.
excellent group, lovely people, and we tried. They do a lot of contact boxing, which I know that everyone is highlighting non-contact boxing.
Yeah.
And when we say, so once when we do pads, so pads would be we hitting the instructor, and he has some pads on.
Yeah.
Usually that's the moment that people like most. In this case, they did combine people with Parkinson, and you know what? It didn't go bad. It's people are I would say resilient on one case. I'm looking for the right word.
I would like to say that their legal
they're
system over
careful.
there.
They are careful. You know, I don't like to underestimate people with Parkinson, and above all, I don't think people are children. So I think people can control themselves.
You do have a legal system that's a little different over
true,
there.
true.
We don't have the tort reform that we have in
Yeah.
So that's part of that too.
So not by this, I'm just highlighting some of the things that were particularly different in that culture, in that country, right? So and this is important because it's the lessons that we learned from the program was when people are actually engaging with each other, that's the moments that they like most, right? So it actually was very popular, the moment that we are playfully trying to hit each other. Okay, playfully, this is important to highlight.
And there was this one person that was a semi-professional boxer in her 20s, and watching him get into the ring with Josefa, I was
have
like,
the video.
oh my Lord.
I'll show you the video after.
She didn't see it coming, but she caught up quickly.
So
it was great. It's awesome.
So our paper itself, our goal at that time was, we've been trying this in the clinic. I think there are specific movement patterns that might be more relevant. We need to get this out. So basically this publication had to do with us being able to provide tools and this information. So we have associated to the paper, people can download videos that they can maybe apply in their sessions.
In practice.
Okay,
yeah.
So it was sharing knowledge was one of the goals. Let me just show you a video so that you understand what we produced for it. One step, 1, 2, 2 steps, 2, 1, 2, 3, 1, 2. Okay.
Introducing dual task right away.
Let me just actually take out the sound and explain it to you.
Mm-hmm.
So the instructor sends you to go to a punching bag, and you are on your own and you can punch, right? And why not add in something else? Nothing stops you from adding in a sequence of thinking, right? So he takes one step and he punches twice. He takes another step, he punches twice. What we are building here are just a suggestion of making you add in a little bit more cognition and thinking while you are doing the punching. Does that make sense to you? Yeah. It's simple enough. People can look at these videos. It's not. Of course, I'm creating at this moment for that gentleman who actually has already experience, and we just develop a sequence. I say, yes, the person can do that on their own. You can also discuss this with the instructor. It doesn't make sense. How can I increase this for me? How can I make this more engaging for me? I can punch twice in up. I can punch once down. So I can challenge myself to do different things using the same instrument. This is what we want to share with you. Different things that we created. Again, it was for people that are thinking of creating boxing programs, could have ideas about how to also engage, obstacle training. He has on each segment where he's going, he has different instructions. And it can become more and more complex. Now he's jumping, and obviously not everyone can jump like him, but the truth is people are very high functioning. They go to these classes, so there are people out there that do like that challenge. So once he jumps, once he goes below, right? So just again, creating activities that will give you just a little bit more of the ingredients that we want for boxing. So it is possible, it is shared, it is out there. Things that we learned, as I was mentioning, is the circuit somehow isolated people. So it's when the instructor sends you to the circuit, you are on your own mostly. Hopefully we can bypass this by sending 2 people to the same station. And so that means that we increase the engagement and the playfulness between 2 people. And so I started building activities that would be something like this. I'll explain in a second. So one thing that I want to highlight is giving space for playfulness and for enjoyment. And you know what? Because our goal is aerobic exercise, number one. If the people do if they are active, if they're engaged, and they get tired with the exercise as well, so that means I'm already happy. We've achieved goal number one. Allowing people to be more playful makes it more enjoyable, more adherence, right? So I will always put fun above anything else, because if we take ourselves too seriously, this becomes more of an obligation than actually, the fun of exercise. And I would say forgetting about Parkinson is being able to do something fun, right? And when we go to these activities, we want to forget about it, even though we are surrounded by people with Parkinson. So these are usually things that people teach me, okay? So it's not me coming up with this. And so you can see I have different types of people with me in the ring, and I'm able, as one person, I'm able to monitor the performance of 4 people, right? The woman, as you can see, has more dyskinesia, so she has more balance issues. As soon as I call out her name, I go behind her. So there is ways for us to adapt the safety of these type of activities. It is perfectly feasible. What am I doing? I'm giving a letter for each one of them. So one is A, the other one's B, the other one's C, the other one's D. And then I want them to be very attentive, because when I say A and B come in, they have to know it's their time, and they go inside and they punch, they have a sequence. And then I say A goes out and C comes in. Now D goes out. And so as you can see, I'm playing around with the instructions as we are building the exercise. Hopefully this doesn't sound crazy to you all. Mm-hmm. And I usually assess the exercises by the amount of smiles that we have. So people are smiling, they are enjoying themselves. That for me is the criteria of success. Now, one of the things that we learned from this study was there has to be a clear distinguish between what is me doing boxing for fun, for fighting against the progression of the disease, for example, and also something as, no, I really want to use boxing for something therapeutical. And this, we can't confuse it, because then you have fights between professionals. No, what we want is to transform people into boxers. And no, we don't want boxers. What we want is for people to be well. Sometimes we might hear this chit-chat among professionals, and it's
not healthy.
It's not needed, because we are talking about different things. So maybe in a house call, this is what I do with someone using boxing. I am trying to focus on helping him be able to get out of the couch better, to rotate in bed. I have very specific goals for his Parkinson. And I need to motivate him to move. So yeah, so I put him on some gloves, and I'm able to keep him engaged, and he's enjoying himself tremendously, right? Or I can have no specific goal, and what I want is just keep the person engaged. And so equipment, this can be anything, right? I just actually left the gentleman on his own, and he's just inventing all the sequences. He's really engaged with it. Sorry about that. And then there's a reason why the gentleman obviously has the elastics, because that helps me protect the amount of effort that he's doing. So if we organize it, we can get all the goals. That was our experience from that one. And then there's obviously more studies that came after that.
For sure. You're going to pull one of them up here? Yeah. So these people were actually more focused on balance. And again, I think you start looking at some of the research, that does seem to be a consistent throughput. Some people are also identifying the intensity and maybe progression, but for sure balance. And they did a community boxing program. They had a dozen folks in there over a couple of weeks. And again, they did 2 specific tests. One I was not familiar, called the Fullerton balance, FAB. I usually think of frontal assessment battery, who's kind of my speech therapist. And that showed benefit, where the timed up and go score didn't actually show major differences. And timed up and go is a really common test with a cutoff that shows increased fall risk. So again, it's always difficult to figure out how to set this up in a way that actually gives you a blind and actually doesn't influence. There's a lot of placebo effect, but it's still it's still good that they tried it and they got some information out of it. It was retrospective too, and that's always a little bit more. That means that they went to records after the fact and looked at who benefited or didn't, rather than doing something where they took a test right at the beginning and a test at the end and then 10 weeks later or something like that.
So imagine an enthusiastic therapist will look at this paper and will say, oh, wow, we can get balance out of boxing as well. This is fantastic.
Yeah.
So now I need to know is how can I increase, even know as a clinician, knowing that we need specific exercises for balance, how can we incorporate that in boxing? So that was my next challenge was like, okay, so if we can get the results on balance, let's make it even better. That means that later on, we had the challenge of creating a boxing program in the Netherlands. And the idea was to assess if I add in more kicking, will that give me additional benefit on balance? So I think this was also a nice, intriguing one, that someone could say it's kickboxing, but it's just adding in more. The protocol was basically comparing two groups, one that added in kicking and the other one that didn't. And we were looking basically on our primary outcome was balance. Now, curious enough, and not the results that we were expecting, both groups improved significantly on balance. So there you go. Sometimes research, we can say this is like a negative study because we found out what we aimed for landed up being the same thing, but it's still positive for us to have this knowledge. So if we have someone saying, oh, kickboxing is much better, it's like, you know what, there is actually a study that shows that maybe on balance, it's the same thing. So it helps people make decisions every time we add on different things that we know about programs. And it's never negative because we know that we can clearly recommend both and both will have outcomes.
Well, especially, and I think you get to this in the paper, and that's what I like about this, is that you could use it as an engagement tool, so that maybe adding these other components can make this more challenging for people who think it's not challenging enough. Mm-hmm. And I always wonder, and again, I'm a speech therapist, so I want to stay in my lane a little bit, but doing some of that movement might be strengthening different activities as well, and not so much focused on balance. It could be in other areas, right?
Yeah, I would push it more for reaction training, and okay. Obviously it helps me always complicate. I would say increase their complexity, and that so it's like 1-2 punch. Now let's bring in a kick. So it's with variations. I think it's just a different example of variation of types of exercises. Yeah. That's nice to explore. So this was another paper, and then we head into 2023.
Yeah, I mean, this is another boxing program. I have to make sure I'm getting the right one.
Yeah, I think the emphasis on this one was the non-motor. I actually have it here.
Yeah, you had, and I think this is interesting because they were doing kind of a modified UPDRS, meaning that's the one that your doctor does with all the movements, but they had to do it online, and then a lot of surveys that went with it, and the surveys all showed some benefits for non-motor features and quality of life and depression, but not apathy, if I remember. Mm-hmm. And then the motor features, the movement-related stuff, also improved as well. That tracks, it makes sense. And again, mm-hmm. It's hard to get a study that has tons of the right physical measure unless you really design it out front and then come into it that way.
Yeah, so we know that exercise obviously benefits all the aspects in terms of motor benefits, gait, balance, strength. And now the recent interest has been how does this influence non-motor, sleep, depression. And in this case, apathy was not strong, but it's really challenging to treat someone with apathy. So I can say boxing was probably the best solution that I've found to motivate someone, and trampolines as well. But okay, on another note, let's finish on the research with one last study.
I mean, this is interesting to me because they were basically going to assess a boxing program. This is down in Texas on respiratory measures of phonation. So when you are a speech therapist, you can do measures that measure how long you can hold a vowel, how loud the sound can be, and you can also measure with a manometer pressure and maximum expiratory pressure or inspiratory pressure. And what was interesting about this was just a general boxing program that they were doing that wasn't focused. And in the end, again, another negative study. They didn't show much difference. They showed some benefits on maximum expiratory pressure, so maximum exhaling. We've talked in some of my programs about this expiratory training, so along that line, and they were able to show some benefits there. One thing, though, is nothing seemed to go down over time, and this was over the course of, I think it was 10 months or 9 months. It was a long time. And so you could theorize that perhaps this staved off any issues as well. That's a little bit of a stretch, but it's okay. Again, I think for a program that's not focused on speech, on voice, it's interesting that it had any benefit. But again, I would say that's probably due to the effort, basically you're doing a high intensity approach. I'll say that when we do boxing, and when I did it in Colorado at Power Punch, when we were bringing that program up, we incorporated voice specifically. We either incorporated the breath as part of the moves, and you'd make a sound that would be associated with a punch, or we would do some of the dual tasks where we're counting out there using the voice in a healthy way, which is what I'm describing here. And I think, again, it adds to intensity and complexity, but I also feel like then you're in an environment where you're doing a lot of effort. Here's an opportunity to add some of the voice there and get more out of the workout. So I'd be interested in taking their approaches. They had kind of a good design and applying it to a program that maybe just did a little bit of voice in there. I kind of make the same analog, and I won't get too far off on a tangent here, to choirs. Choirs for Parkinson's have interesting data, but most effective data usually shows that a choir that works in conjunction with a speech language pathologist seems to show the benefit. And I could say probably similarly for any exercise program, if you can have an SLP put in some components, it helps. And then just real quick here, and this is me just going to get on my soapbox for a second. If you're in a class and they're using their voice and they're telling you to do stuff, when you hear someone saying shout or yell it out and all those kind of high tension, high effort, that's not what you're looking for. You're trying to produce sound in a healthy, loud way. That usually means adding air. That also means that maybe your posture, if you have something that's great for boxing so you don't get punched, we're not as focused on that as clinicians. We want to make sure your posture is maybe more upright so you have proper breath support, and that's how you produce better sound. So when you hear someone saying, yell and shout and just let it on, it's like those are struggle behaviors that could actually force you to use muscles up here in an unhealthy way instead of focusing on improving breath control and using the voice in a healthy way or the breath in a healthy way.
So we did want to lighten up the presentation, just showing some examples of what they could be in different ways that you might not be used to. So this was us.
Fine, good, great, fine, fine, fine. Again.
So it's basically we've associated a word with each punch, which is something that maybe if you're working on your own in the circuits, you can try out, which is coordinating your voice with the punch. So if you think of a sentence that I want to say, like, I really enjoy this, and like, I really enjoy this. And of course, this might feel simple, but if you are trying to challenge yourself in thinking about longer sentences or paragraphs or words, or that you're integrating and coordinating with the punch, that becomes more, I would say, more challenging and so more engaging as well.
I think dual task is always a great equalizer for sure.
At the time, just incorporating, I would say, specific exercises from the speech therapist, I would say, that prescribes to the person with Parkinson, do these exercises at home. So what I would usually do is like, what did your speech therapist tell you to do at home exercise? Can we incorporate them while we are boxing? So that's very helpful, because then you get your homework done in the class as well, and we reinforce each other's work. And this was just an example of an articulation exercise that he was doing that was fast enough for him to do, and which I took up the sound so you didn't actually hear it.
Yeah, he's using a combination here, but listen to it for a second. And I would say exactly what she's doing with the box master there, using that. I would go back into our clinical room in the speech therapy and say, can we do that, do the motions, and then I might focus more on ways to extend the way he's saying the sound. So of course, this is really focused on the tip top, tiggery top. It's almost like the lips, the teeth, and the tongue.
Yeah.
It's that kind of articulation, not a voice exercise. So practice it without jamming it.
Which was the challenge between when we're doing work with the speech therapist, which is I need sounds that are quick because it's boxing, it's punching. So I can't have the because no punch takes that long. So it's when teams come together and they brainstorm about how to integrate this, it's not as easy as it seems.
No, it's not insert tab A in a slot B for sure.
Okay, so coming back to our story here, it's like I would say that efficacy will always depend on the person you're working with, because it's the person you're working with responsibility to get to know the disease that you have, to get to know how to get more education on it in case they don't, expertise. I also think there's a role for the person with Parkinson, which means if you are working with someone and you can help them get access to maybe, I usually have like people that are in gyms and they would take the guidelines, exercise guidelines to the instructors. And usually people are very open to getting more knowledge. So I'm not expecting issues with that. I think it's a good strategy. I think it creates the bonding because the people with Parkinson are more informed at this moment. People are having these talks, right? These type of access to knowledge, and I think sharing it with the instructors that might be also in busy schedules and not being able to keep up with everything that's coming out is good, is helpful, is one way to help. And this is an example that I like to give. It's there's key things that I would highlight in boxing, and because there are specific rules that have been created for boxing, which is you put your most side that goes forward, you got your foot in this place, you've got your hand in this place. And I tend to try to break those rules, not because I want to do the opposite, but basically because I want you to work on your most affected side. So sometimes if the person already comes with knowledge of boxing, and then I have to try to really reinforce this, what we want you to use more is your most affected side. In Parkinson, there's always an asymmetry. It's part of the diagnosis. You might not feel so much that asymmetry if it's your right side, because it's a side that you might use. And so sometimes you don't feel that difference, but usually there is always one side that is more affected.
Even with that, where like if you're a right-handed boxer, you have your left foot forward and vice versa. Sometimes too, it's also nice to just be completely symmetrical, because then you can really focus and highlight the rotational side of it. So again, unlearning. This is where I think coming at it from a clinical perspective versus I'm a Golden Gloves boxer.
So obviously there's specific movements and things that we can go into detail here with you, but that's not our goal. The goal is just alert for things that I think are really important, and this one's important. The voice screaming, I think that's important for you, John, right? And this it's always working most, even if the instructor sends you to, because sometimes, but they told me to do something different. But think about it. You go to the circuit, you have your punching bag there. Why not do more with your most affected side, right? I think it's possible for people to take that action without compromising or offending anyone. You all agree?
Yeah.
Right? Taking some control over what you do. Okay, so how about safety? As John shared, obviously in different countries we have different rules, and so I live in this wonderful country where I can punch people and it's okay, I won't get sued. But I'm just saying that in a playful way. Obviously we want to keep people safe. And what does safe mean, right? Is it overprotecting? Is it not protecting? Because then if we become too overprotective, we're not giving people space to actually explore movement. And so it also becomes negative. And it always goes back to who is applying it, right? The instructor will get to know you as you go to the programs. The more I'm with someone, the more I can actually predict the movement. I know if they fall, where they're going to fall, right? So that expertise on its own is, as people work with you, they will gain expertise about how to keep you safe. And then obviously it depends on what you are applying how we're using the exercise. Let me show you what you could maybe say is kind of mad exercise or something. You will see different people, and these are all people that work with me 2 or 3 times a week. It's people I know really well. I know how to push them. For each one, I might be applying the same. I'm either pushing it more up, more down. I'm giving them different instructions, right? So I'm just taking the benefit of the enjoyment of punching something. In this case, this person has, for example, more balance issues. So I'm standing behind. I'm still giving him space so that the person can feel they're fighting, without being overprotective. So even though it looks like a crazy exercise, and safety might be an issue, because I know sometimes the therapists look at this and think that could be a problem. But it's about knowing the person and knowing what I can apply, what I can get away with. When I suggested groups, this was an example. So one of the things that we learned from that study was really, okay, so how can we reinforce more activities? The part that people liked most in the class that came from our research study was actually the warm-up and the cool-down. And this was astonishing. The part that people liked most was the warm-up and the cool-down in Sweden. And this means that is the part where people were more engaged with each other. They were interacting with each other. This was very strong knowledge. And so it's like, maybe I can have people punching. So this idea of this, maybe I can have them. It looks like it's a circuit, but it's not. They all have an exercise. We are doing it together. So it's the same punching, but we are all doing it together. So it's not each one doing, obviously everyone is doing it in their own way that I adapted. But I just to highlight that it's possible for us to do those things. This would be more of maybe a scenario from the US. This was taken from social media. It's available on YouTube. It's not a video. It's not my video. And we can look at this. I want to see everyone's hands. Is this something that you guys would identify yourself with? Yes or no?
For those who did boxing?
Yes.
Yeah.
Okay, I see a yes.
I know it's been a long time before you get a nice American flag in your clinic over here in Portugal. We'll maybe bring one over for you.
So it's good. We have lots of mixture. So as I was saying, it's like as a therapist or exercise physiologist, this is a big group. That scares me, right? For me, I think it's very. But another one thing that I can compliment is it's fascinating how resilient people are to just keep going. So I can say congratulations on the profile. The people have different profiles. There's more active people, profiles in Parkinson disease, right? And it's fascinating to see how people really keep going. And I can give you an example. If I did this in Portugal, people would punch once and they'd look at me, what's next, right? So it's intriguing how culture plays a role. And I think so these classes really work because people are self-motivated. This is the part of the class that I say that people really enjoy most. And I would be really scared of that gentleman. That you have different components, as we were discussing. Is it even feasible for us to think, okay, what could we improve, right? I think any program should always be thinking this. Whatever we do is how can we do it better? I think we are always assessing the outcomes, and I'm sure that this won't be different. This is a mixture of different programs, so it's nothing specific. And I wish that it's probably a question. I don't want to be unkind, but I think it would probably be a question of money, right? Why do we have groups so big? Why do we have big groups? If we had smaller groups, we might be able to help people be more personalized. I think this is a logical rationale, but obviously costs might be an issue. I would imagine that's the reason why.
It could be. Again, I think what I like what they do is they incorporate care partners into the program as corner men, and I think that's very cool.
Yeah. And okay, so let's just check in with the chat and see if everyone's okay. If there's any specific questions that you want to ask, I can finish here on the safety before we go there. Can we, so in this rationale, can we do better? What can we do? How can we keep people safe? Because I think the priority when we see big groups is how can we keep people safe, and obviously incorporating care partners, incorporating other people, volunteers is very helpful too. So you help people that might have more difficulties. So I think these are all very natural things about precautions, having a very good warm-up, the cool down routines that will help you to reduce a little bit more of injuries, of risk of injuries, and making sure that if you feel something specifically different, you are able to have a moment where you can talk with the instructor about it. I think people feel that they can have control over that. What would be the specific concerns that we'd have for Parkinson? So things that would happen only with Parkinson, or we're not, if you didn't have it, Parkinson wouldn't happen so much. So excessive fatigue. So we know how, imagine your medication stops working or is not doing what it's supposed to do, and you have an unexpected moment where it's more low, and you are in the middle of a class and you want to do what your colleagues are doing, and so you continue to do what you did the day before. This is peer, I wouldn't say pressure, but this is what happens when people work in groups. They push themselves more because they're with others, and this is actually good for adherence. It's good to push yourself, but the truth is sometimes in this situation, it would mean that the person would be draining himself more. So excessive fatigue, and probably the rest of the afternoon will be to recover, those type of situations.
Yeah, I think also with the fatigue too, that some people might end up having more soreness in certain places if they're doing different activities in a way that maybe isn't, if they have any kind of pre-existing issues in the shoulder or something like that. That's something I see frequently is people after several weeks start saying, oh, I'm having more hand problems or more shoulder issues. And it goes along with the fatigue. I mean, it goes along with all the pre-existing.
This excessive fatigue is a criteria that you have to use because we do the research so that it can help you, and we know that there is a thing like the right dosage.
Yeah.
Right. And that yes, we do want people to push themselves a little bit more, but we don't want you to overdo it. And what is this overdoing? Right. There's parameters that we follow for that. Okay. So don't accept that as something that's normal. Me feeling completely exhausted and drained. That can't happen. It's not positive for you. And then we have things like, as you could see in that video, right? There were a lot of what we call, people with high functioning, early stage Parkinson, and they can really give a punch. And I'm really scared of those situations, believe me. So that means sometimes we have some people that might be more impulsive, more risk behaviors, which in a group is quite challenging. We have to identify that because one person decides to jump onto that square or something, right? And then the whole group will try to do it as well. So I usually tend to push these people aside and say, I want you to understand that when you do something more radical, other people will try to mimic you. So, try to keep just knowing that sometimes impulsive behavior can also be excessive exercising too much.
Yeah.
Then we have things that would be more expected, like changes in posture. Just being in that busy environment is enough to increase the need for cognitive resources. So we know that when we are more attentive, that something is compromised, which is balance and posture. And so there will be, when you are doing an exercise which requires more attention, so even if you're doing like a sequence 1-1-2 or 1-2, you're doing the probability of our posture being compromised is great. Obviously, the instructors are on you on this. I'm pretty sure everyone is always like, put yourself straight, put yourself straight. I know that's one of the particular focuses when it is a Parkinson specific class.
And again, you're saying that, just to clarify this, that the posture changes here are due to your attention being focused on doing the activity correctly, doing the right combination.
That's one reason.
Yeah. And
fatigue would be another.
okay.
Lack of balance would be another. So your posture changes when you are in a more unbalanced situation. There's lots of things that can cause the changes in posture. When I think about boxing itself, it's usually all the cognitive load that's happening, not only because of the exercises, but also because of the fatigue and because of the environment itself.
The effort. And I'd also say that sometimes, again, you want to be careful about trying to adopt positioning or postures that are more ideal for boxing, less ideal for Parkinson's. You just kind of find a middle ground. Again, defensive postures can put you in a kind of a crunched kyphotic position that we're not looking for in our world.
We have a video that's coming up, and it was someone that did boxing before, and so this was very difficult to change because it was already incorporated.
Yeah.
But most people will be reinforcing this.
Yeah.
Okay, so then another thing is also alongside the hesitations of everything that's happening, especially if you have so many people in a group, is turning, making quick decisions, having to change circuit. The alarm goes off, you have to change. So all these type of situations might bring on some more stress and might cause some hesitations in movement, in walking. So there is a concern about increasing episodes of freezing of gait, which is when your feet get glued to the floor. I think most clinicians, most exercise professionals will be worried about that. And then motor fluctuations, as I gave the example, which is unpredictable on-off phenomena when the medication might without you expecting it, you've drained it, and then the person becomes stopped, right? You can't move. Increased dyskinesia means involuntary movements that might happen, and as we do exercise, sometimes this might increase. People will know this. Tremor is another type of involuntary movement, not the same, but sometimes people perceive that it increases after doing exercise. What will happen, even if it does increase, it will then, as soon as you rest, it will come back to its origin. It's supposed to come back to the same level of interference in your daily life. At that moment, it's just regarding the fatigue that's happening and that's influencing it to increase. A quick reminder that sometimes this is a situation of doing boxing online, and sometimes the posture changes that happen. The person's so focused on what is happening in the screen, and that had no idea that this was actually happening. So I took a picture just to highlight, if you're going to do this on your own, make sure that you have ways to monitor yourself and to see if there's not compensations happening.
Just to point it out there, if you look at the picture to the right there, the upper picture, you can see that they're on a little iPad. I think that's also difficult. I think the bigger the better if you have it on a laptop, but yes.
True, we can always adapt the environment, but in this case, the person was not even perceiving that this was happening.
Yeah.
So you might feel the person's in the position to start. No, actually, when she did start punching, she would go back. So the picture on there is when the person's just listening to the instructor, and then when she actually starts punching, she would go into this posture. So just alerting have people around you. Videos and photos are everywhere, and that's a beautiful way for us to be able to monitor ourselves. We had this curiosity of asking, when do people actually leave boxing programs? So this actually helps us also identify these situations. And so we have different examples here. For time's sake, that I'm just concerned about time, let me just read specific ideas. Let me see. We have seen people leave because of worsening of motor and non-motor symptoms, but we have also seen few people leave because boxing is not my sport. Okay, so this is someone that is perceiving different reasons. Then we had Sarah telling us that they might leave related to structure, to knowledge and understanding, because we did set up the program in Sweden, and then Sarah felt that she wasn't identifying herself with the program and left it after a couple of months. And so we have like attitudes and behaviors, physical environment of the training facilities, like accessibility, also have to be thought about. In this boxing club, actually, there was these black stairs that went down, and
way down. Yeah.
It really provoked a lot of anxiety. We actually had one of the adverse events of the program was someone that had a panic attack on those stairs. So one of the things that we did was just adapt it with queuing on the stairs, so white lines, and that reduced the impact. So things can be changed, obviously. That's why we do the research, so we can identify. We had other people mention that, you know, I needed a bigger challenge. So again, the groups are big, people have different physical levels. And when the person's feeling that maybe it's not enough, in this case, it's like, oh my goodness, the person left. And so I trained with the marathon and started CrossFit. My goodness.
Wow, CrossFit. We will not be offering CrossFit.
As you can
soon.
see, never underestimate a person with Parkinson, right?
That's from Colorado, I bet. Yeah.
And then the one that worries us most is what is not reported so often in studies, and we don't have enough research about this, which is injuries. And so studies should always report on adverse events that exist in the programs, but for some reason these are underreported. Yeah. And so that's why we go to social media in this case, because people are freely talking about it. And so you have this example where the person says, I couldn't seem to stop hurting myself.
To be fair, the instructors changed the program, but that just made the program less interesting at that point for her.
Yeah. Let's see other examples. So we had here Karen that says fitness was better than most others, so in line with not being enough challenge. And then she also highlights an interesting thing, which was scheduling for someone that was working full time. So sometimes the schedules can't correspond to those situations. And okay, my specific needs didn't fit the needs of the group as a whole. So she didn't want to have the group pushed back, right?
Karen is a machine. I mean, she's an exercise
exactly.
machine.
So we have a lot of people that participate there, very, very intense training, right? Then we had Gavin that shared with us that it was about the unsustainable costs and also geographical distances, which I know in the US is pretty difficult, people driving long distance to get to the places. Another person mentioned the injuries. I dropped out because I couldn't function with the pain in the arm and the shoulders. Okay. Quickly, just highlighting, if you think about Parkinson specific, what do you want to look out for? You want to look out for people that reinforce Parkinson specific amplitude movements. And so the most familiar program is about the Lisselman Big program, but it's about doing big movements. And usually this is probably incorporated in the warm-ups. I'm guessing that most programs that have knowledge with Parkinson, they do this in the warm-ups and maybe the cool-downs as well. So it's naturally part of it. Then we want to obviously think about the safety issues that we talked about, and also guiding people, like you can have the boxing bag and we can have some red crosses or something, like queuing, like I want you to punch up high, right? So instead of punching low and I'm having a bad posture while I'm punching, why not challenge people to just put a red line on the boxing device and whatever you're using, and just challenge you to do it in better posture and movement. We want to continuously think about, adapting the frequency and the dosage. So it's not possible that we will keep up the same type of treatment for a whole year, right? Yes, we want people to improve, but we want people to be self-aware about what makes more sense and when do I need to change. So those skills are gained with more knowledge. And then obviously the instructors can use different teaching methods so they can help you either facilitate or increase the challenge.
And in a perfect world, I think the instructor is looking at each person, and you get a whole big class, but you're, okay, I want to make sure that I'm addressing posture or balance or whatever for this individual.
Yeah, you'll have common goals that the therapists will want, the instructors will want to approach for sure. Okay, so we come to also a fun question, which is it fun for me? So fun can be defined in different ways, and this was the group from your questionnaires, what you answered regarding what is your overall level of satisfaction in these sessions. Most people are satisfied. Right?
Very satisfied.
One person that's neither, but no one specifically not satisfied.
Yeah.
Satisfaction is an outcome that is used in most of the studies, so to understand why people stay in programs. And then we think, okay, so what might not be so much fun? Let's think about someone that said, yes, my tremor goes crazy with vigorous exercise, but it's worth it to me because I feel better after, and exercise has lots of benefits for slowing progression. Okay, so this is someone then even mentioning this, how the tremor might increase with the boxing, perfectly normal, or perfectly, I would say, recognized as something that can happen, but it should normalize after. And then someone say, okay, I'm glad it's not just me, because people perceive this, but it's not so much discussed. And so I started a kickboxing workout and cried my face off today on the way home. This could be an expression. This could be
cried my face off. Yeah.
If it was literally that painful, okay. Sometimes people find fun in pain, so it's just we don't know the whole story. Just highlighting, make sure you know yourself and where you can take it. And another one that I think I learned throughout these years is really for us not to take ourselves so seriously, because as you know, the research is quite weak in most of the things that we are trying to project. There are strong evidence for A, B, C, and D, but the rest, the truth is we don't really know. What we do know is that when people are really enjoying themselves, there's more learning and there's more adherence. There's more perceived benefit. People will forget what you did, but they do remember how you made them feel. And I know Delta's here is actually on the call, so she's going to enjoy watching this. Now, of course, you could ask me, what exercise was that? It was absolutely nothing. I just turned away for a minute and they were playing. And should I be always like, no, you got to work? Honestly, no. Again, I like to be flexible, and if the enjoyment factor is present, there's no reason for me to be obsessive therapist or clinician or fitness instructor or health professional, whatever. I do know some people that I've had that experience. I've had someone that in class and they had said, oh, this is too much playing. I respect that. It's someone that unfortunately is probably not dealing so well with the acceptance of the disease. And it's impossible for us to please everyone as well. But I think this method has kept the people that I work with longer motivated, and I'm with the patients that I have at this moment 2 or 3 times a week for years and years. So it's my goal to create new things and to keep them motivated, and this has been the glue. That doesn't mean
mão direita, mão esquerda, pé direito, pé esquerdo. Preparados? E mão esquerda, pé esquerdo, pé direito.
She's saying left and right. Esquerda
mão direita,
that's left.
Mão esquerda, esquerda.
Okay, I just wanted to get to the laughter part, right? And you must look at this exercise. Is it possible for us to do boxing online? Yes. Do people think it's the same thing? No, it's not. You can't compare apples and bananas, right? It's not fair, because what we can do online is more limited. We have to guarantee the safety, and we're concerned about too much movement. But the truth is, so we have to be a little bit more creative and find new ways to be able to engage people. And this is actually a video from a young onset group that I work with. And so, just trying to push out the fitness. At the end of this session, my goal is to keep people moving throughout the whole hour, which means, again, my focus is on physical fitness, engagement, and cognition as well. So I have at least the ingredients that are possible to do. And yeah, we can't really punch each other, so we've lost that. But again, it serves the population that it targets, right? Transportation, it bypasses a lot of problems. It is an option that you have.
And again, I really think that being able to put a dynamic background in there and do stuff with it, there's a lot that we can do with it.
Yeah, and so I'm going to quickly run through this one. This one's a funny one as well. Basically, so this was the environment of the boxing club that we talked about in Sweden, and just having space for us to really play around with the ring. And
again, that guy's gonna
my God, Josefa!
Yeah, my skills were being questioned. But the truth is, and it's in line with the message that I want to pass. It's like, we don't want people to become boxers, right? I mean, I hope you don't need to be boxing anyone in life. And so it's about the exercise itself. And that's when I say, don't take ourselves too serious, because it's really about the exercise. And then sometimes we might be stuck in professional convictions of, no, you have to do it this way or that way. Just have that mental flexibility of questioning why, and can I do it differently, and can I adapt, right? Always questioning, how can I do it better?
Yeah, got to keep reinforcing that. Build it from the top down of what are you trying to address, not what is the sport telling you need to do.
Yeah, so you can have different forms of having the engagement. I think this is the challenge. It's more, for example, that of having, how can I have two people maybe punching each other without really hurting each other? That's easy. I just put some resistance in the elastics, and they can't really do a lot in terms of. So this was one creative idea to help that engagement. It's fun, and there's no injuries. Another way is just working. I do it, now you do it, and they have a whole sequence of boxing things that they have to punch. They're not really. So different formats. I just want to maybe share and give hope that we can do better. We have to do better. The boxing is a great form of exercise that people can use, and we just need to now get more research to help us improve the program so that we don't stay with what we have. We can integrate so much. This, from your questionnaires, was which was the part of the class that you liked most, and what people said was training directly with the coach. So it goes in line with what we were saying now. It's the engagement and being able to punch is the fun part.
Yep.
What I suspect, as I was saying, probably the glue is the community. Most people go to the programs because they make friends, because they have people they have similar problems, and so I think this is a strong element of community-based exercise, and boxing surely has this. Yes, so I think we would like to have some input from everyone, so I just want to finish quickly. So key ideas is, yes, boxing can give you a lot of clinical motor benefits and non-motor benefits as well. There's research to support that. Safety is an issue, so keeping safe has to be an issue for any type of exercise. How we keep people continually motivated and in adherence depends on what we do and how much engagement we can provide, positive experiences when they do the boxing sessions. Be mindful that there is in-person and there's also online programs that sometimes may help when you are not able to get to these places, that can complement each other. And we definitely need more evidence. As you can see, it was short, and we need to make these programs more accessible as well, with all the barriers in terms of context, and also think about how can we make this, I would say, less costful, so that maybe we can have smaller groups.
If you can find a way to do that, for sure. Different countries are going to have different approaches for sure.
Very good. So thank you all. And we would really like to hear your experiences. So can we have a volunteer?
Or anybody have anything to ask of questions as well? I know
we know some people, so we'll pick on you. It's okay.
Does anybody have any questions about boxing approaches or other thoughts about any of the components we talked about?
So one of my questions was, do you need to worry about overdoing it from a heart point of view, or how does that get assessed?
I would say most of the programs, so will have probably an assessment before you start participating. Correct me if I'm wrong, if anyone's participating in a Parkinson specific program, right? And I think any form of exercise, usually you have like a triage before, if you have like health issues, comorbidities. That would be monitored. If we can control that during the training, probably in very big groups, I'd be more concerned. But again, People will push themselves. There's when you have risk behaviors, that means those are the people that might not be able to see when it's too much. But most people will tend to do less than they are able to do. We see this, for example, online. So here I am, I'm pushing, and the person's doing this, right? So it's the amount of effort. Unless someone's really pushing you, you will be going to the limits.
The calibration is an issue. There are situations if you're doing something like on a treadmill or on a bike where you could be working really hard, and autonomically your automatic nervous system may not catch up as fast in Parkinson's. But hopefully, if you're doing something like that, you are monitoring it with some kind of cardiac monitor. Again, 9 times out of 10, it's not in danger of working too hard. It's just like your voice gets quieter, your steps are smaller. The calibration issue is more prominent on the other side. Too little, not too much.
We know my not volunteering information is not a concern.
Yeah. No. It's interesting stuff, though. I mean, good things to consider. And again, when you're going in there, if someone's not asking you those kinds of questions, doing a little bit of intake, okay, why not? Tell them so that they can take it in there.
I'm going to do something very dangerous. Susan, you want to share your experience?
Well, I do want to share, yes. When you were talking about being challenged, I find that it's balance between knowing my own body and when to push and when not. And I always feel like if I can show up the next time, I've been successful in that part, because some of the young coaches really try to push, and like jumping jacks, for example. I know jumping is not, I don't jump anymore.
You feel you have control over saying no, right?
I do ask for modifications to some of the exercises that I know in my particular situation are not good for me to do.
I think that's very important, is to be sure that you are feeling comfortable and confident in saying, hey, this is what I know my boundaries are, or this is what I want to be worried about. Everyone should be responsive to that. Okay. Just being mindful of our time. Does anyone else have any questions or inputs or ideas before we will
punch out?
Yeah, we will.
But let me ask, was it useful?
Yes.
Great. Glad you can join us.
We just want to help people be able to monitor these situations so you can protect yourself more. That's how we keep people safe.
Yeah.
Give them knowledge.
Such a popular program. We want to make sure you're doing it right. All right, folks. Well, have a great afternoon for you. Great evening over here.
Thank you. You too.
Thank you so much for coming in.
Thank you.
And do try it if you haven't tried it.
Yeah, we're doing it.